Action study was a very large and robust sampling of not only patients but also providers of different sorts of providers, mostly primary care but other providers as well as the employers and taking their perception as to how obesity is treated in the U.S. And it really did uncover a lot of the barriers that we were suspect would be there, but to actually put some numbers or some data behind that was really eye-opening, if you will, that both providers as well as patients feel that they need to discuss obesity, they need to address it in the office visit, but they maybe don't have the resources, they don't have the time, they don't have the expertise to be able to have a productive conversation or productive discussion around how to go about best treating this obesity. And even though obesity is well recognized now as a disease, many patients in the survey clearly indicated that they felt it was still sort of their responsibility, and they were hesitating to go to their physician, whereas physicians felt like it is a disease, it's more my responsibility, but yet I don't have either the time, which was very common, or the resources to have a good conversation about what to do next. It actually comes down to basics around obesity awareness, that obesity itself is a leading, if not the contributor to many of these other comorbid conditions like high blood pressure, cardiovascular disease, diabetes. But when you see a busy primary care office and the physicians there treating patients who may have numerous of these comorbidities and conditions, a lot of times they look at the guidelines and what immediately they can impact, which is adding a blood pressure medication, adding a diabetes medication, looking at those two conditions. Whereas obesity for them, as we found in the survey, is quite more difficult, quite more complex. They know it's going to take a lot more time. And so maybe that's in the back of their mind that, well, I know this patient likely has obesity or is overweight, but if I screen for them and then we identify it, what do I do next? And I think that's where we want to help bridge that gap, give them the resources, help them to know what to do next, help the patients know what questions to ask or to even ask for the screening. Because we know obesity is well underdiagnosed and well identified in the chart, and though patients are really not comfortable bringing this up many times. So as we mentioned, it goes right on to the easier things, if you will, which is checking the blood pressure and what we need to do about that target, looking at your LDL, adjusting your statin to get that down, or adding a diabetes therapy, versus what I think many would agree is a much more complex and chronic long-term discussion of how to address this obesity component.